Hi. So thank you for joining us today. My name is, for those who don't know me, my name is Christina Pinzone.
Hi, my name is Laura, and I'm the Digital Media Manager at Stateside Affairs.
So thanks for joining us today. Laura and I and the team at Stateside Affairs thought it'd be important to discuss COVID-19, how far we've come, and vaccines and how they're being distributed across the state of New Jersey.
Yes.
I know we're creeping up at almost a year since Governor Phil Murphy declared a health emergency in the state of New Jersey. And while I know so many of us have been impacted by it, whether it's been staying home or we've contracted it personally or we lost a loved one, I think we're seeing a light at the end of the tunnel. And it's really improving right now with the vaccines that are being distributed in the Garden State.
And we also felt it important to include the Spanish speaking folks, being that we were both raised in Elizabeth, primarily Hispanic, primarily full of minorities. We found it imperative to do this live in both English and Spanish. And we have a very, very special guest joining us today. Christina, you could talk a little bit further.
Perfect. So joining us today is Andrea Martinez-Mejia. She's the Chief of Staff at the New Jersey Department of Health to answer your questions regarding COVID-19 planning, how vaccine recommendations will be made, and the work going into ensuring the safety of COVID-19 vaccines. Thanks, Andrea. Thanks for joining us.
Hi, it's really, really a pleasure to be here with you guys and another fellow person from Elizabeth, because I actually live in Elizabeth, New Jersey. So I'm in good company and I'm really excited to be here.
Yeah. Thank you for joining us.
Thanks. And Andrea, we have to really commend you and your team and Commissioner Judith Persis-Chelli.
Yes.
I forget how the governor addresses her, who should not be named, or how
the lady who doesn't need no introduction.
Lady who doesn't need no introduction. She's been doing a phenomenal job. So congratulations to you guys. This hasn't been an easy task for anyone. And, again, I really thank you on behalf of, our team, my mother who recently received her vaccine, to do this or to take part in this conversation, to really debunk some myths, to walk people through the process, and hopefully answer some questions that they may have, to do it live.
Sure. We're really excited, as I said.
And we just wanted to quickly remind folks, the second half of this program will be in Spanish. La segunda parte de este programa será totalmente en español, así que quédense esperando algunos minutos a que hagamos la parte en español, ¿ok? Gracias.
Great. So why don't we start with this, Andrea? So some people have felt that the vaccination process was rushed, right? It's actually been in process for a really long time, but we're just in the recent months have been seeing it roll out and being administered to people across the state actually across the world. And as a result of that, people are questioning the efficacy of the COVID-19 vaccine, which there are, a couple variations of that. And when I mean variations, different companies that are administering them. So one of the questions that have come up with, again, the communities that we've been working with, and a majority have been Latino communities, but mostly like Black and Brown communities, is they worry about the symptoms after receiving not only the first dose, but the second dose. So can you explain the vaccination process to us? And also at the moment, who qualifies and why?
Yeah. Sure. So we know that these vaccine seems to be rushed, right? We've heard prior to COVID-19 that vaccines takes a long time to develop one. And, we are really lucky to say that, the technology, the ability that that every people around the world work on these vaccines and they working in a light speed to have it here, but it is safe and it is, it has a high level of efficacy against the virus. The science tells us that. This vaccine was developed and have gone through multiple clinical trials before it has actually obtained their emergency certification to be given to the public. So we are confident, and our panel of experts, we've been working with a panel of experts since last March, and in all things COVID, and they have reviewed, they have looked at all the different scientific information that came out about the vaccines. They have given their recommendations, and we are confident that this vaccine is indeed safe. It has a high level of efficacy, and we should not be fearful of this vaccine. I know that a lot of folks think that by getting this vaccine, they're going to have the virus injected in them, and that's not the case. This is a vaccine that doesn't use a live virus. It's a new technology in terms of that. We're not using the live virus to create this vaccine, so you're not getting the virus into your body. In terms of right now, who qualifies for it? Here at the state of New Jersey, right now, anyone who obviously we started with the people that were more at risk, those direct healthcare workers, employees of the different healthcare facilities that were in the thick of the response of COVID. They were part of the eligible group for these vaccines. So anybody who's a healthcare worker, works for a hospital or a healthcare facility, they can access the vaccine. Then we look at our persons over 65 years old. We know that this virus had no mercy for our older population, and they were also hardest hit, and we had a high percentage of mortality among our elderly folks. So they also qualify for this vaccine. And then we're also looking at folks who are 16 to 64 years old who have chronic medical conditions. Again, if you have some of other diseases, other illnesses that you're dealing with, makes you more prone to get the virus and get more complications if you get the virus. So we want to make sure that we address the mortality and the morbidity issues at first. And obviously, once we have, and I think we have good news coming from the feds, where we're seeing more vaccines are coming. And like you mentioned, there's a lot of other labs who are developing vaccines. So when we have more vaccines, we'll be able to open up to the general population. So right now we're trying to make sure that the limited amount of vaccine that we're getting is going to the folks that are at the highest risk and that they have faced the highest mortality and morbidity as a result of COVID.
Great. Thank you for answering all those important questions. I know that question had a lot of different points to it, so thank you very much. We also wanted to share a question that we received from a resident in Roselle. It's a video question for you guys.
I recently contracted COVID-19 and I'm now in recovery. There are rumors in the community of who and who does not need to get vaccinated. If someone has already contracted COVID-19, should they get vaccinated? If so, why? And also, how long should they wait to get their vaccination?
Yes, so right now the recommendation that we have is that anybody, whether you have or have not gotten COVID, you should get vaccinated. Folks, and the recommendation here at the state of New Jersey is that those individuals who have gotten COVID, they should wait 90 days before getting the vaccine. So we encourage that everybody, whether you have it or not, consider getting the vaccine. And if you had COVID or recently got diagnosed with COVID, wait at least 90 days before you get the vaccine.
Thank you. I know, like Christina and I, we both know, and I'm sure you know, or have a friend that has gotten it. And I think that's a question that a lot of people wanted to know. If I've had COVID, should I still do it? Is it more risky if I do it? So thank you so much for answering that.
Not a problem. Yeah.
So,
yeah, go ahead, Christina.
Just a quick anecdote. So my mother recently, I actually registered her on the state website, and then I found out that there were other websites that I could register at. But so luckily she got a phone call back and she was able to get her first shot just about like 2 weeks ago. And I'm So we're excited about that. And at the same time, she is fearful because she's been hearing about, what we recently were talking about, the symptoms and, and if she's going to have a headache, if she's going to have a fever. But one of the things besides that came up, they did ask for her insurance card. And so one of the questions that we keep hearing too is to receive the COVID-19 vaccine. Is it free? Does your insurance pay for it? How does that part of the process work?
Yes, the vaccine is free. Some places are asking, and our website registration form asks that as well as for your insurance. If you don't have it, doesn't matter. You're not gonna be charged. You're not gonna pay for the vaccine. It's absolutely free. If you don't have insurance, you're underinsured. Don't worry about it. You still qualify for the vaccine. We are not limiting this vaccine to anybody. We have said it. Anybody who works, lives, or studies here in New Jersey, we will give you a vaccine. We're not checking your immigration status. Yeah, it's free and available to all.
Cool. Laura, you had a
Great.
question?
Yes, I had another question. What are some of the main misconceptions that the state has faced, when people are talking about the vaccine, and how has the health department been approaching these doubts and concerns that we've been talking about since the beginning of the live stream?
Sure. So the number one, and we talk about it, the number one is how safe it is, the vaccine, how, the efficacy of the vaccine. And, I just discussed it, the science is there. We know it's safe and it's, it has a high level of efficacy and help us prevent the virus. There's a lot of questions too now because we're hearing a lot about the variants, and there's a lot of questions in terms of, well, if I get this vaccine, but it's not going to protect me against the other variants. We're hearing, and the science is there, but you can get this vaccine, and so far, what some studies have shown that it also protects you for some of the other variants that we're seeing. Obviously, a lot of people are afraid of what are the symptoms. I'm going to get COVID after I get this vaccine, or what are the symptoms? And we have heard it varies from individuals. So some folks haven't had any symptoms after the vaccine. Some folks have a little bit, some mild symptoms, and some folks have struggled a little bit more with the vaccine, whether they have headaches or chills, like flu-like symptoms. And what we know is the vaccine is working. You're gonna feel a little bit of discomfort. It varies from person to person, but you're not getting COVID, and it's just your body responding to the vaccine. So and then a lot of those symptoms goes away after like a day or two. So. You're gonna, in some cases, you have a little bit of discomfort, but for 1 day or two, it's not like having the virus at all. And the other thing too that we're hearing, and we're trying to, especially for our women of childbearing age, we're hearing some folks that are concerned if is this somehow is going to affect your fertility, and that is not the case. This vaccine does not affect your fertility. So that's another myth that's particular around women, and young women or women of childbearing age is a concern that we have heard. Then it goes into the issues of how the cost of the vaccine. Like some folks don't qualify for the vaccine, and as I mentioned before, the vaccine is free and it's available to all. And we're really trying to get. There is a limited doses right now, as we mentioned. There's a limited supply of vaccines that we have. It's increasing, and in the next couple of weeks, we hope to see a lot more vaccine, and then other vaccines are coming into the market. So soon, we're hoping that we're going to have more accessibility to this vaccine. But our goal is to try to get the vaccine to as many people as we can.
Great. Just a quick shout out to Martha Roldan. Joining us, Millie Hernandez from Lebanon, Pennsylvania. So we're spreading the knowledge, tri-state. We just need someone from New York and Connecticut. And Steve Clayton, thank you for joining us. Continue to ask your questions. We have a few that came in Spanish, but we will address those in the second portion of the program. So, Andrea, the state of New Jersey recently announced a community-based vaccination for underserved communities. And roughly 15,000 residents, I believe, are to be vaccinated in March in houses of worship and community sites. And I believe that just today, the administration, again, Governor Phil Murphy, joined by Commissioner Persicelli and you, visited Trenton and Somerset, where there were dozens of people that were vaccinated. So where can these sites be found, and how much more accessible are they in comparison to the existing sites that are in place around the state?
Sure. Yes. So in partnership with our Office of Emergency Management and with FEMA, we're able to open up a couple of sites across the state. And the goal of these sites really is to try to bring the vaccination site to the communities, particularly those communities that have been the hardest hit as a result of COVID, our Black and Brown communities. And so we have announced, 5 sites that are going to be rolling up in around March. And Franklin Township was the first one. And this week we're opening up Trenton. We were there yesterday. And we are going to be opening up Elizabeth soon. And then we're going to Violin and Patterson. We are doing this in partnership with some community organizations, some houses of worship. We know that the people, trust their community leaders, they trust their faith leaders, and we wanted to ensure that that trust and help us educate the individuals and give them access. We know that. We have a system and you can do it online. Christina, you talk about your mom, but not everybody has access to that. It's not always easy to navigate. So the goal of these sites is for those folks who are really having difficulty getting access to the vaccine. They can do it into this different way. We're doing it in partnership with their local municipalities and their local health departments. And you can find information about this program through your local health department and your local municipality.
Okay, perfect. That was actually one of my follow-up questions. So if I was a resident in one of these towns, Trenton, Elizabeth, how you mentioned, so I'm going to reach out to, say, for example, go to the city's website and look up the health department, or I can call City Hall and ask to be connected with the health department there, and they'll set up an appointment for me or for someone else.
For you, they will. Yeah, this is again is for eligible groups, individuals. So the ones that I mentioned earlier, 16 to 64 with chronic medical conditions, over 65 years old, or if you're like in a healthcare worker that haven't been able to get a vaccine through your employer or through another facility, this will be the case. Yes.
Perfect. Laura?
Sorry, I was muted. I know this wasn't included in the question, but kind of like a short follow-up. Are any of these sites doing kind of like a first come, first serve without appointments, or is it just exclusively with appointments?
At this point, most of our sites are doing it by appointment only. A lot of it is just we have to make sure because of the vaccines and the limited doses. So we're trying to get as many people to get an appointment as possible. Yeah.
Okay. Thank you. And then my other question is, why is the vaccine necessary or effective? Once again, we've talked about this from the beginning of the live stream, just kind of to drive the point. And once again, can you get COVID positive? Can you become COVID positive after getting both doses of the vaccine? This goes back to kind of those misconceptions that we were referring to in the beginning.
Yeah, so we're still having a lot of studies about, how is this vaccine going to fight COVID? Or, there's still questions about, are we going to have to get vaccinated against COVID every year like we do for the flu? Or, we get these doses of vaccine and that's it. That's still, those studies are being done. What we know is getting this vaccine, similar to what happens with the flu, it protects you against the virus. And he also, if you happen to contract if you happen to contract the virus after you've been vaccinated, the effects will be less than when you're having the virus without the vaccine. As we still have, we still more studies needs to be done. I mean, the vaccine is new, we know it's safe and its efficacy is there. But in terms of the long term and how it's going to protect you long term, or whether or not we're going to have to get vaccinated every year, we still don't know that. What we know is that it helps us contain the virus. It helps us, some folks prevent to get sick, and those who, if you happen to get the virus, the effects are going to be minimal, or, less than you had if you wouldn't have this vaccine.
Should someone consult with their doctor before obtaining the vaccine, or specifically if they have a health condition that may be tricky? Do you recommend them consulting with their doctor before getting the vaccine?
Yes, I mean, there are some groups of individuals who should be talking to their doctors before getting the vaccine, particularly if you're pregnant. You should be talking to your doctor before getting the vaccine. And then some individuals who might have some immunocompromise, so you might have some of the any illness that may not be listed as a chronic condition on the list that we have provided by the CDC. All that list can be found on our website. You should be talking to your doctor, or your family doctor, and ask them their recommendation. Absolutely.
And you said the symptoms are usually felt for only 2 days after getting the vaccine for the most part. What are some of those symptoms? What are the biggest symptoms that you guys have experienced?
What we heard from folks is they get headache, chills, some muscle aches, some flu-like symptoms. Folks have taken Tylenol or any ibuprofen, and they feel better. So those are, for what we hear from the most part, those are what some of the symptoms that folks have heard.
Well, I just want to remind folks that let's not forget that this is a novel disease. It's something like this, of this nature, like this is history, like for us, so it's natural also that we don't have the data to back up a lot of it. And health experts, while they're experts, they're on the side of science, and they know that in order to be effective at their jobs, they have to collect data in order to determine the efficacy and determine certain practices. And even just recently with mask wearing and wearing a double mask, and proving that can be helpful with preventing the, and contracting COVID-19 and all the other variants that we have been talking about. So I know that the Department of Health has developed an app, right, where people can also go. Okay, so what is it?
Is the COVID app, which is very helpful, and we encourage everybody to download it, because although we have the vaccine, that's great, and we still cannot remember that, and this is very, very important. We still cannot forget the recommendations, the public health recommendations we had given out. We still have to mask, and now what we know, so the CDC is now recommending to double masking as as an extra protection. We still have to wash our hands. We still have to be socially distant. We still have to, limit our, social gatherings. We still have to be mindful of, being in indoor spaces for too long when there's not a lot of good air flowing, because the virus is still here. We know that. The vaccine is just another tool in our toolbox to fight the virus, but we cannot forget these other measures that have been put in place. And obviously the app is one that it helps you in terms of monitor your symptoms. Like if you're not sure, you can click on it, you can put some symptoms, and it will tell you, give you some guidance. All the numbers, we're still following a lot of the numbers, the statistics, where are we, how many cases, how many people are dying from COVID every day in New Jersey. And also, if you, and that's very important, if you are exposed by any reason, and we still don't know, you might be going to the bank, or you might be going to the supermarket, you might have taken public transportation, and you don't know if any of your fellow passengers or the individuals in the supermarket had COVID. But if you have this app and the person gets somebody tests positive, and they have the app, they have a code. When your contact tracer calls you and said, you have tested positive, they give you a code, and we plugged in this code in your app, it will alert anybody who was near you. So if you go into the restaurant and you had the app and somebody had it, tested positive, you will get an alert. It's confidential, so we don't tell you who it is, but at least you know that you were exposed, and we recommend that you go and get tested. I mean, we still cannot forget to get tested on a regular basis, even though we don't have symptoms, even though we have the vaccine, because the virus is still in our communities, it's still there, and we cannot forget any of those public health recommendations.
And so that leads me, and we're close to like wrapping up the English part of the program, but again, we talked about the development of these community sites because we've seen, Black and Brown communities disproportionately impacted by COVID-19. For what reason? I don't know. You can probably explain a little bit more about that as a health expert. But any parting words for those communities, and what is what do you necessarily want to emphasize to them? Like, why is it so important for them to continue getting vaccinated and also get tested, as you just mentioned?
Yeah, unfortunately, and we know that our communities have been affected. A lot of it is because we do have some, we have talked about, and a lot of the efforts pre-COVID have been in trying to eliminate the social determinants of health. We know that our health is not only, our physical health can be affected by environmental changes, environmental situations, and also, our lack of transportation, lack of access to healthy foods, lack of access to regular doctor appointments, not having insurance affects how you treat. You might have a medical condition you're not aware of. So that, unfortunately, when you have a virus like COVID, affects, and it takes it kind of pries on those vulnerable individuals. Also, we know a lot of our folks are the frontline workers. So when we're talking about folks who have been exposed with a lot of people, you're in the public, you're taking the bus to go to your job, you're working at the supermarket, you're working in a healthcare facility, you are exposed to a higher risk, right? And that's what, we know that it's important to bring a lot of the access to the vaccine to our communities. We are developing a plan that is aimed to do that, to bring more vaccine when we have more doses of vaccine, to bring it to the community, working with community leaders. We're training, and we want to develop a community core of community volunteers that are going to be talking to their neighbors, talking to their friends, going to the hair salon, going to the restaurant, and educating our folks about the vaccine. I understand that a lot of people might be fearful of some health experts that, sitting and talking to you over the TV, but it's different when you see your friends, your neighbors talking about the vaccine, when you see your friends, your neighbors vaccinated. So that's what is important for us to reach to the communities and going through the trusted partners. We know our communities have and rely heavily on their trusted leaders, and we want to partner with them. Why is important to get vaccinated? We need to fight this virus. We need to make sure that no more of our Black and Brown folks are dying or got infected of this virus. We have lost way too many to this virus. So that's what's important. And let's not forget, we all played a part. So continue to social distance, continue to wear your mask, continue to wash your hands, and get tested. Even if you don't have symptoms, continue to get tested regularly, because these are the ways how we are going to beat the virus. And someday soon, hopefully, we get to more normal life. Our life has been disrupted for a year, and many of us have not been able to see our family, our friends. We haven't been able to hug our parents or grandparents or our nieces, nephews. So, and I know that is hard, and it has taken a toll. But we need, all of us, we need to do that to put an end to this pandemic.
Thank you so much, Andrea, for joining us. We just wanted to wrap this up, but we wanted to, obviously, before we wrap up in English, we wanted to share your contact information and that of the New Jersey Department of Health. So here is Andrea's LinkedIn. That's the department website and their social media handles. If you want to share anything else, any other social media handles, Andrea, feel free. But yeah, this is basically the main things that we thought would be useful for people to have.
Yep, absolutely. If you go to any of them, you have all the information for us.
Perfect. Thank you so much.
It's a pleasure. Thank you so much for having me.